Hi, my name is Alexandria Barut, and I am a nursing student from Cedar Crest College, and today I will be talking about exercise therapy and its effects on depression. Depression is one of the most common psychological disorders experienced among Americans, along with those worldwide. In America specifically, there is about 6.7% of Americans who experience depression in just 1 year. So, if we can come up with a way to greater reduce the depressive symptoms, it could definitely help these people out. People tend to turn towards pharmacological therapy and just stop there. If we can have an adjuvant therapy that people can enjoy and definitely see a greater decrease in depressive symptoms, then we should go for it. So, I'm talking about exercise therapy and how it can decrease depressive symptoms. The clinical question, or the PICO question that I'm looking at today and looking to answer is, in patients with depression, does the use of adjunct exercise therapy compared to treatment as usual with no exercise decrease depressive symptoms? So, when finding articles and literature that would answer this PICO question, I went to the Cumulative Index of Nursing and Allied Health Literature, aka CINAHL, and this was good for finding nursing-based articles. You could make sure that the article was written by a nurse. And this was especially good for us because we want it to be nursing-based evidence practice. So it was definitely a very strict site and allowed you to do a very thorough advanced search. I went to WorldCat Local as another search engine, and I was not as successful because it was not as strict, although it did have an advanced search. I used that basically all throughout my college career, but I found that CINAHL was better for finding what I needed to find based on nursing articles. But I definitely turned to WorldCat Local as a backup source. I made sure that when I did my search, I limited the years to 2011 to 2016, and this would just ensure that the literature was current. We want current evidence-based practice because everything is constantly changing, so we want the most up-to-date. When I was doing my research and trying to find articles that pertain to my topic, I typed in exercise and depression. This is the kind of word combo that got me the best results and the most results. When I typed in exercise therapy and depression, I did not get as many results as I wanted. So I went back and I typed in exercise and depression, and I kind of just sorted through and made sure that all of the articles were similar and talked about the same exact thing. And that's kind of what got me the best results. In my synthesis of evidence little chart here, it basically goes through the 3 articles that I chose and which ones were the best, and basically all of them were either randomized control trials or randomized pilot trials. All sample sizes were pretty small. My largest sample size was about 50 participants. So it basically goes through and breaks down each one and talks about what's going on and if it was a good article or not, and all of them were good articles. For recommendations, we should allow the patient to choose their own modality and intensity of exercise. There's a lot of hesitancy in depressed patients to want to exercise. So if we can kind of get them more interested and let them have more control and a choice, this can kind of help us out a little bit and keep the dropout rates decreased. So the next one was for, in the future, we should consider an objective assessment of their kind of physical well-being before even beginning the intervention, because there are so many people who, of all ages, who experience depression, and there may be other disease processes that are going on within each patient. So if we can kind of be more flexible and kind of mold an exercise treatment to that person individually, that we may have more success with them, and it may also help them to keep on track with their regimen and exercise therapy. And also I talked about having a larger sample size. So if we have a larger sample size, it'll be more accurate evidence, and it will help us to be able to apply our findings to a greater population. So in conclusion, we decided the purpose was to identify if adjuvant exercise therapy is effective in treating depression, and we did find this. So depression is definitely affected by the amount and intensity of exercise that a patient is willing to go through. Thank you very much.